Well, good
Hey,
morning,
Dave.
good afternoon, and good evening to everyone. It's really an honor and a pleasure. I really appreciate the invitation from Kevin and Whwb to have this opportunity to speak. Also, Marianne and Kevin both for helping us set this all up. And I do appreciate you all being along for the ride. So with this information that I'm presenting, two pieces I want to put out there mainly is that I'm looking at selections of historical aspects on both the pandemics and how they move forward, as well as how control banding has been tied into it. There's a lot of slides, a lot of visuals, but most importantly, I want to throw out there that any slide you have, there's a wealth of information behind it, and I'll be going over it very quickly. So anything you might be interested in, just shoot me an email. I'll be happy to assist. We'll be talking about risk communication and control banding as a basic starter. We'll be talking about the risk level based management system and how it ties to pandemics. The history relating to both pandemics and IHOH, and right now I'm probably going to end up picking the industrial hygiene lane. If I happen to say that over occupational hygiene, you'll understand, and how that applies to control banding and where we are now with COVID-19. So for the basics of risk communication, first and foremost, I think we all know what to be doing at a red light and a green light. We stop at a red, we go at a green. And if we can have a system with workers where we just had red and green for instructions related to environmental health and safety, I think we'd all be doing quite fine, but that just doesn't work. So what happens when you add a yellow light to that combination? It ends up being quite subjective in that everybody does something a little different. Some people stop every time, some people go every time, and then some people assess the traffic, and others who might be doing something wrong might look for the police. And in the field, and especially when it comes to risk communication, we have to understand that we are, in their eyes, the workers, the police. So really all the risk level process does in control banding and how I view it is it splits the yellow into two risk levels. Risk level 2 is closer to green, risk level 3 is closer to the red. And at this point, I think it's really the most effective way to, with 4 risk levels. There's a lot of science behind this, but you maximize the complexity while still minimizing simplicity. The more risk levels you have, the more complex, the more expert driven that system runs. At the bottom of the screen, I just want to point out that for the risk level based management system, unlike a lot of control outcomes, this is more towards occupational risk management as a control. But once you have risk communication in the risk level, everything that the workers need to know flows from that risk level designation. What hazards are present, controls, PPE, if you need to use it as a management process, sign-off documentation, training, medical surveillance, everything that's necessary is known once the risk level is known and the risk communication flows. At Lawrence Livermore National Laboratory, where I work, they have a risk level based management system designated for industrial hygiene, and there is not a hazard you can throw at industrial hygienists that we can't find a way to band and put the control banding process into place. It's not just industrial hygiene, we also have it for some industrial safety, health physics, as well as environmental. So it just so happens 2 years ago, almost to the day, I presented at the ICO conference in Dublin on the topic of emergency preparedness and response and control banding. And so a number of these slides you're about to see fit into that, but the whole mindset of where I was trying to get to is that you do have multidisciplinary banding possibilities that come from the risk level approach, and how can it be applied to emergency response. As part of that presentation, we were looking at all different types of emergencies that you may face, chemical, physical, biological. But one of the things that we really made sure to point out is that we're looking at not just the emergency responders the first wave, we're looking at the different waves of responders. And then in the end, we're trying to focus on all workers that may be a part of what's going on. So the bioagent was just one component. And it begins taking an early look in history into the early 2000s, where WHO did have a very robust program associated with epidemic alerts and responses. At the time, the process was in place. At the time, they also had an industrial hygienist on staff. And therefore, when they were looking for international partnerships, IOHA had a very strong role with WHO in a relationship, as well as a work-related role, which is very important. And then when SARS hit, they got a chance to put this all into practice. So they learned a lot from the whole process, but so did we as a profession. At the time, IOHA was pushing for at least N95s to be utilized as part of the protection of healthcare workers, first and second and third wave responders. And at the time, the pushback was surgical masks were the norm. By the time we got to Ebola at the beginning of the last decade, healthcare workers came onto the vision around the world as being highly at risk for all of this. And with Ebola, the death rate, not just the infection rate, was extremely high. Now you have to understand, primarily, the goal was to keep healthcare providers out there and working to be part of reducing the risk and handling the patients. And then secondarily, there was acknowledgement that this was a work-related risk for illness and death. As we moved in that period of time, we had the internet. The internet brought a lot of changes. It did help a lot with the response related to everything going on for Ebola, but it also helped increase the panic amongst all the people and the citizens in different parts of the world. In the US, if one person, typically a healthcare worker, might have been next to someone or handling a patient who had Ebola, all of a sudden that vector, that person, became a risk level 4, and that's how the outbreak would move forward, and the panic took over. The CDC decided to use a risk level approach and tied it to public health action. And in doing so, it calmed the panic of the vectors and put some reality by putting a simplified risk communication into place so that we would have an appropriate response commensurate to the risk. Right about that time, industrial hygiene found itself into the zeitgeist. And when you find yourself into a comic, and this one actually I think is quite funny, I think that's a good sign that we are part of the response and the understanding we are part of helping with pandemics. So now to take a flip over to control banding, this goes into the late 90s. I just want to throw this out there, not that this ties directly into the pandemic response, but this particular target control banding approach from Cost Essentials is very similar to some other things you'll see currently in use. So if we go back to 2006, we can see as a response to the SARS, AIHA had a committee that put together the role of industrial hygienists in a pandemic. And as part of that response, they had both a risk group tiering of risk levels, as well as infection control measures relative to the risk levels. Now, if you will notice that even if you go down into the bottom right corner, that at the highest level, there's still an N95 respirator listed. Now, again, this is 2006, but also based on the timing, that was considered advanced. On the call is Deborah Nelson, so it's kind of nice to be able to put this out there. In the 2009-2010 framework, she put together a risk assessment tool for infectious diseases. And in doing so, she used the risk matrix of severity and probability. And the tool, as an outcome, had response modes by transmission, droplet, aerosol, surface, etc. And in the university environment, another issue at the time was meningitis B, and the outbreak is on campuses. So this was an extremely helpful and very simplified, very early look at how we can apply control banding to diseases that are communicable. So now as we head into 2011 into 2013, we have the Canadian standard Z94.4, the hierarchy of respiratory protection. A lot of this work is based on the McCullough and Lisa Brousseau work on the appropriate selection of respiratory protection related to bioaerosols. And with that said, once you start identifying the appropriate hierarchy, it becomes much more simplified to be able to have the correct selection based on risk of the correct healthcare facility related respiratory protection for infectious bioaerosols. So this was also translated in 2013 by the IRSST, an excellent document that's out there, as well as the BioProtect tool, which was a publication that also gave some really good applications on how this could be put into practice. So now, flashing forward to where we are now, this comes from online, Mary Cameron, Socotec UK, as the variety of the hierarchy of controls that have been applied to COVID-19. And again, what we need is consistency. So there's a number of different opinions on what the hierarchy might be. And depending on the situation, we as a profession just need to make sure we have the right hierarchy in place. This came from Zhejiang University School of Medicine in China in response to COVID-19. And you can see they're using the risk level approach to both identify appropriate protective equipment as well as the scope of application. This comes from Canada, from the Environmental Abatement Council of Ontario. And doing pathogen cleaning, you can see in both section C, the scaling of respiratory protection that, or personal protection and respiratory protection that might be needed, as well as the precaution levels in a risk level format in section D. Now, with OSHA in the US, the Occupational Safety and Health Administration, they put out guidance for COVID-19 that started settling into that standardization, consistency, and simplification that we really do need. What they did in this document was classify jobs into 4 risk levels: low, medium, high, and very high. There were job classification examples for each risk level, which is extremely important to assist the user in making sure you're making the right risk level selection. And once you have the risk level, as the risk communication flows for engineering, administrative, PPE, and safe work practices. Even when you get to the point of the concept that came out of the CDC for Ebola, the White House also used risk levels as a public health management system to be able to get the right type of action based on the commensurate risk. And this is from Lawrence Livermore. This is credit to Sam Paik, my cohort, another control bandit out there. And with Lawrence Livermore, as soon as this all kind of hit the fan, the request was, how do we apply this to respirators? And they actually had the expectation that we would give them a control banding response. And that's what we did. Now I'm going to take a half step back into November of 2019, only to acknowledge the prognostication of this entire situation and how it might be necessary to apply control banding. This particular article from Sietsma, and also has Lisa Brousseau, both University of Illinois Chicago colleagues, taking a control banding approach for aerosol transmissible and infectious disease outbreaks. And this particular setup with the risk group, the exposure, the control band, and the selection of controls led to a framework that was extremely useful for this discussion. So within this framework, they considered a semi-quantitative risk analysis. You define the risk group by the bioagent. You have the exposure likelihood and duration. And then with risk group and exposure, you now have your control band. And based on the band, you can select your controls, whether it's through the source, the pathway, or the receptor. And like all control banding scenarios, you should start with the conservative approach. If you're not sure exactly what you might have for the veracity of the agent, you start conservative. You can always downgrade the controls. The examples that they gave, and I think it's important to emphasize, is they gave examples that were beyond healthcare workers. It was package delivery with the coronavirus, school maintenance with the influenza, and prison workers with tuberculosis. So in bringing this all home, I just want to emphasize that we know what to do. It's about involving the industrial hygiene, occupational hygiene profession in the processes. The standardization and the consistency that we know as professionals, we can provide into this process as we identify all responders to the workforce and essential workers, which are part of this extended ongoing issue. Because once we have the workforces identified, and then we have the risk levels correctly put out there, all the controls flow and the risk communication flows. For the hazards controls, no matter what they're working with, but the risk communication, if we all can speak with a singular EHS language, we can have consistency at the national level and consistency for risk management of this very dangerous situation. This goes back to 2018, and this is from the AIHA Synergist. And this quote, which I think still fits today, is we continue to see them underrepresented. Them, that's us, the hygienists. Because many response planning professionals do not fully understand how the contribution of IH can satisfy response needs. And in bringing this to a close, I want to emphasize, if we're involved in anything related to COVID-19, I want them to tell them that you're an IH. If you're involved with any kind of publication, spell it out for them. Let them know what our profession is. Define it for them. And let them know and make it clear why our role is essential. Because in this process of applying simplified risk communication, we are telling them the way that we as hygienists think without actually showing them what the profession is. That's what control banding does. It has a long track record of success in teaching the uninitiated about our profession. But like with everything, crisis also presents opportunities. And there are opportunities that people will take advantage of. But when it comes to this particular situation in COVID-19, the IH-OH profession, we're the heroes. And we need to make sure that we are no longer unsung as being heroes. If we use control banding, if we simplify the risk communication, if we reduce work-related risk, we will save lives. And they should know it, that our profession is what is behind this. We are the experts. And I thank you for your time.